University of California Cooperative Extension and University of California Davis Veterinary Medicine is bringing to you a recording from their March 2024 webinar series. This series was co-hosted by University of California Cooperative Extension advisors Tracy Schohr, Grace Woodmansee, Rebecca Ozeran, and specialist Dr. Gaby Maier. Additional resources from this webinar and other cattle health videos can be found at ucanr.edu/sites/rangelands/cattle health. This session is focused on neonatal beef calf health with featured speakers Dr. Gaby Maier and Dr. Essam with UC Davis School of Veterinary Medicine.
First, before I start, I would like to acknowledge that what we're going to present today, we receive funding from CDFA, Antimicrobial Use and Stewardship Program. We appreciate their generosity for providing us to do this type of research. Our agenda for tonight, I'm going to go over colostrum management, and Dr. Gaby Maier is going to talk about vaccine. I will jump back to talk about castration, and Dr. Gaby Maier will end by naval care, and of course, we're going to answer your question at the end. Excellent. So first, we're going to start tonight talking about the colostrum management in beef operation. Let's get started and talk about what's the failure of passive transfer. So as you know, that the colostrum is the first milk that produced by mom or dam for calves. And we called it the liquid gold because actually that's a gold for calves. And without colostrum, they will not be surviving. So colostrum coming with many benefits for calves. It contains the all nutritive nutrient that calf gonna need during their first few days of life, including vitamins and minerals and protein and fat as source of energy, which is very important for growth and maturity of the calf. But not only that, the most important part in colostrum, when calf born, the calf born naive with immature immune system, and they obtain their immune system by obtaining maternal antibody, or what we called immunoglobulins. And we do have different types of immunoglobulin, but the most important one is immunoglobulin G, or what we call IgG. And just for you, that immunoglobulin antibody is the type of protein that produced by mom and goes through colostrum to the young calf when they suckle the milk or colostrum. So it's very important for calf to receive that during first few days of life in order to help them to fight infection. And it's very important for prevention of disease such as scour and respiratory disease that we see. So the only way of calf to receive this antibody through colostrum. When calf failure to receive sufficient amount or adequate amount of this antibody during their first day of life, it's gonna end what condition called failure of passive transfer, or we abbreviate it as FPT. And the research done have shown that calf with failure of passive transfer have twice risk of dying. And also we found that this calf we're gonna have high risk of developing respiratory disease and also high risk of developing diarrhea. And if calves survive, that's gonna have long-term effect on their performance, like they're gonna decrease the average daily gain and their body weight. So this infographic I'm showing you here, showing that there are many factors associated with failure of passive transfer. And we're not gonna go over this infographic in detail, but my point here to show you that there are factors associated to the dam itself, and there is another type of factor associated to calf. For example, here, dam vaccination. If the dam or mom not well vaccinated, that means the calf, when suckle colostrum, will not get enough antibodies that protect them from common disease. Something like dystocia or difficult calving, and we're gonna cover that in details. Another factor related to calf, if the calf born healthy and are able to stand and suckle the mom within the first few hours after birth, and the amount of colostrum they are receiving, the quality of colostrum. So all of this factor are risk factor for failure of passive transfer. Let's touch base here for dam-related factor. As I mentioned, the vaccination of the dam. So in well-vaccinated herd of beef per operation, the cow will be well vaccinated. The cow usually receives their 5-way or 8-way vaccine. That vaccine gonna giving to mom. The mom gonna build antibody, and this antibody will pass down to calf through colostrum. So it's very important to make sure that your breeding cow receiving the right vaccine at right time. Another factor is dam nutrition. The research shows that if dam have malnutrition or not receiving the right nutrition at right time, that's a risk factor for failure of passive transfer of their offspring. Dam health. This is very important. We have to make sure that dam are healthy at time of calving. There is no any signs of metabolic disease. Another research found that if we calf have experiencing heat stress or cold stress, this is also another factor that's affecting maternal colostrum quality. Calving difficulty. So when the research found that when calves born with an easy or hard poll or twins, this is most likely have higher incidence to failure of passive transfer. So this is alarming for us to watching this calf, make sure this calf receive sufficient amount of colostrum, and if they need assistance, will intervene on the right time. So the research done found that whenever you found a calf with weak suckling reflex at birth, it should receive human intervention to make sure this calf received colostrum consumption at right time. For factor related to calf, very important for timing of colostrum. Most of calf in beef operation will stand up and start to search for the teat and suckling their dam within 2 to 4 hours. So there is no need for intervention in this case. But if you have calf that born from difficult calving and unable to stand within 2 to 4 hours, here you need to intervene, and you should start to make sure that this calf receives the colostrum within the first 4 to 6 hours. Usually we feed them the colostrum. We give first feeding 2 quarts of colostrum within 4 to 6 hours, and we repeat it again within 12 hours after birth. Why is this timing? Because it's the time where the maximum efficiency of absorption of immunoglobulin happen, and we have intestine pores are open for absorption of antibodies. Very important to quantity we feed to our calf. So we want to give them the right quantity at right time. The rule of thumb here is that you give colostrum 5% of body weight. So let's say if you have calf born average 65 to 90 pounds, you usually require 2 quart or 2 liters of colostrum twice a day. And we give it for only within this 12 hours. We want to make sure that the colostrum we feed to our calves have good quality. And this is a kind of good habit. And just to be clear here, the stuff we give showing to you here, we give you option, and each one have its different level of managing. So you don't have to do that if you don't have any trouble in your cow-calf operation. But it's good to do from time to time to check the quality of colostrum. So feeding sufficient quantity with good quality is very important factor to prevent failure of passive transfer. We're going to go through how to check the colostrum quality. The traditional way that we used to do is, as you see here in the picture in the right side, we used to check the quality of colostrum, what was called colostrometer, which usually measure the specific gravity. And the colostrometer floating here in this picture, floating, and usually have colored scale. And if you see in the green, that's meaning you have good colostrum quality. But this might be not good for on-farm. So nowadays we have what's called refractometer. As you see here in the picture on the left, it's a good investment to have this refractometer in your facility. Might cost from $200, $500, but it's good instrument. You can make investment in your place. For colostrum quality, so remember, it's 3Q: quality, quantity, and quickness. Make sure the colostrum you feed to calf is free from have low bacterial count. The high bacterial count affect on quality of colostrum. The good way to reduce the bacterial count is the heat treatment, which is very common in dairy production system. They have pasteurizer and they do heat treatment, but this might be not feasible for beef operation. And as I mentioned, we take you everything here. You might look for what best work for you. Does this not work perfect for you? But we just showing you what's the optimum management practice. So heat treatment of colostrum prior feeding is an effective way to reduce the bacterial count. And some research showing that something you can buy in your facility, like sous vide machine. Sous vide machine can be used to achieve required safe temperature for your colostrum. Like if you heat colostrum for 140 Fahrenheit for 60 minutes, will kill different type of microorganisms. But again, your operation might be doing good and your colostrum quality, you don't have problem with calves, so you don't need this type of machine in your facility. Okay, let's say if I have calf and I've seen problem, high number of incidents of diarrhea, respiratory disease in my facility. So maybe this is a good time to intervene and start to check if your calf have failure of passive transfer or not. So how I can do that? We do measuring to identify failure of passive transfer by different way. The golden standard is to measure IgG or antibody in the serum of calf. And the gold standard is to do what's called radioimmunoassay or radioimmunodiffusion. But this is need a laboratory, and it's need someone trained and have machine to do that. So it's not feasible to do in farm. But in farm, you can measure the total protein in the serum of calf. So as you can see in picture here, you just draw or withdraw a blood sample, you separate the serum or plasma and took into total protein, which is a good indicator of immunoglobulin. Or you can measure the percentage of total solid. And we can talk about that by using what's called Brake's refractometer. So regarding how to measure the total protein on farm, serum total protein is a good indicator, and that means that this calf received good quantity and good quality of colostrum. And if you want to check at the herd level, usually if you see like 80% of your calf having serum total protein more than 4.2 gram per deciliter, that's a good indicator that you are doing good and your colostrum management practice is good in your facility. How to measure the total protein? By using refractometer. As you see here, this is different style, different type of refractometer. We do have two main type of refractometer. We have the digital one and optical one. Optical one is inexpensive, but you need a source of light to look into. You use a drop, you put a drop of serum here in this area, and you look into the level of total protein. And you have a scale here, as you see in this picture, and you need your colostrum between 5.2, 5.3 or above. That's a good indicator of passive transfer in your calf. If you want to go fancy, you're gonna buy this one, the digital one, which is one drop. You put one drop on the reader here, and this is gonna give you the reading within less than 30 seconds. As I mentioned, there is different model, different style. You can go fancy with the digital ones up to $600. Or if you wanna do a cheaper one, is the optical one with around $100. There is another type of refractometer called Brix refractometer. This is measures the percentage of total solid in the liquid, and it can be used for both. So if you want to buy a machine or instrument to measure both the quality on colostrum and also to determine the failure of passive transfer, this is a good machine to buy. It's called Brix refractometer. And when you use Brix refractometer, you're looking for reading of 8.4% of Brix. When you get this number, meaning your calf have enough colostrum and enough antibody received through colostrum. Let's say we have a calf born from dystocia, this calf unable to stand up for suckling colostrum from dam. So the first thing, you need to make sure that this calf received enough colostrum. First thing to try is to help the calf to stand up and do natural suckling. If this way doesn't work, you start to help the calf by bottle feeding. You have a bottle with teeth and try to give colostrum with bottle feeding. If this option doesn't work, now we have to intervene and do what's called esophageal tube feeding. As you see in picture here on the right, I'm using one of the esophageal tube feeding to give colostrum for this calf. And we're gonna go over that, how to do that. From our research, after we did a literature review, we came with this decision tree, as you can see here on the right. This is very nice to tell you when to intervene and when not to intervene. For example, here, as you see in the right, if the calf born with dystocia, first thing to do is you test the suckling response, checking that for 10 minutes after birth. If calf have a strong suckling reflex, monitor this calf for 2 hours. If the calf stand up and consume colostrum, okay, no intervention. But if there is suckling reflex is weak, now, and it's very easy to do suckling reflex, that you put the finger in the mouth of the calf and see if they're suckling or not. If there is weak suckling reflex, now the assistant required. So if calf unable to stand and suckle the dam within first 4 hours or after birth, you offer teeth, offer bottle first. If not, you interfere with esophageal tube feeding. So here is how we do tube feeding of this calf.
In this video, you will learn when and where to use esophageal feeding for beef calf. There are 2 situations that you might need to use esophageal feeder. The first situation, when you have calf born unable to suckle colostrum or are able to eat by its own. The second situation, we have a sick calf that unable to eat or drink, like a scouring calf.
Esophageal feeders have a rigid tube that is inserted into the calf's mouth, a bag for fluids, and they may have a clamp, such as seen here, that allows to stop the flow of fluids into the tube. There is a bulb that helps to guide the tube into the esophagus rather than the trachea windpipe. And make sure you check the rigid part of the tube for sharp edges that could cause injury to the soft tissues of the calf. Measure the tube from the mouth to the shoulder to check how far you should insert the tube. You can mark the spot with a piece of tape. It is also a good idea to apply a bit of lubrication to the tube so it is easier to insert. When you're ready to pass the esophageal feeder, you can put your thumb into the corner of the calf's mouth so it will more readily open it. Gently slide the tube to the back of the mouth and aim slightly to the left where the esophagus is located, and let the calf swallow the tube. Insert until the piece of tape is reached. Feel the left side of the neck to make sure you can feel the rigid part of the tube next to the trachea. Open the clamp and let the fluids flow. When finished, close the clamp or kink the tube and gently take out the tube. If you want to take blood from a calf, for example, to check whether it has consumed enough colostrum, it is very important that you have really good restraint. To visualize when to insert the needle, hold off the blood flow by pressing your fingers into the jugular groove, and the jugular vein will become visible. Push the calf's head to one side and hold off blood flow with your non-dominant hand. And you feel for the jugular vein, which should feel like a bouncy, like a water-filled balloon. Then you insert the needle and then push the blood tube onto the needle holder to preserve the vacuum. You may have to redirect the needle if you don't immediately get blood flow. Here is another view if you have a helper who can restrain the calf for you. So you locate the vein by holding off the blood flow. You insert the needle and then push the blood tube onto the needle holder. If you push the tube onto the needle holder outside of the calf, you will lose the vacuum and you won't be able to use that tube any longer. And then finally, you can also get a blood sample if the calf is recumbent. For example, if it has been restrained by a rope. But the technique for blood collection is the same as in the other two scenarios.
All right, so we have seen the picture as a video for how to do esophageal tube feeding and how to collect a blood sample for detection of for failure passive transfer. We seen then how to feed the colostrum. So what's the source of colostrum if I need it? Let's say you have a calf that orphan calf that don't have mom, and we need source of colostrum. So the best option is the natural colostrum. Okay, fresh colostrum is the best, and it's a good habit to freeze or keep a bank of colostrum for you just in case if you need it, or froze the colostrum. So here you might be collect colostrum from cow with a stillborn and keep it for just emergency in case. So that's very important to keep it, okay? And remember, each time if you have a frozen colostrum, it's very important to check the quality of colostrum before you freezing and feeding them for calves. Another source of colostrum that should be good, at least you have it in your place, you have a bag of what is called colostrum replacer, okay? And there is available over in the market, and beef calf require at least, when you go and buy these bags, you need to look for 150 grams of IgG or immunoglobulin G, okay? That's very important. Some research suggests between 200 and 300 grams, which is ideal, but 150 should be enough, okay? It's very important, as I mentioned, to make sure and follow instruction of the how to feed it. So usually have an instruction how to mix it, usually come in powder form. So need to substitute that and with warm water and feed it for calf. Another form of colostrum, we have what's called colostrum supplement. And by its name, it's supplement. It's not a replacer, okay? So we use supplement in just in case if we need to increase the amount of immunoglobulin, okay? But it's not a substitute of colostrum replacer, okay? And it cannot replace the replacer. But let's say you have a low quality colostrum and you want to improve the quality of colostrum, you can use colostrum supplement. So again, for prevention of failure of passive transfer, make sure that your prepartum cow have a good vaccination program, you follow your vaccination protocol, and work on your prevention of dystocia. And this can happen by selection of a pool with favorable calving ease. Okay, now we do like for semen, you look for the semen for male that have genes of calving ease, easy calving ease, like, and especially for when you're breeding heifers. Follow the colostrum management, you regularly check the quality of colostrum, okay, and ensure that you give the calf the sufficient amount of colostrum. We're going to provide these different resources for you to go over. I know colostrum is a big topic, but I hope you will we give you here a brief summary how to do and how to deal with colostrum management at your facility. With that, I will be happy to get your question at the end of webinar today. Thank you.
So the vaccine, so why do we vaccinate? So the vaccines are essentially an extension of colostrum use. So we want to achieve the same as what we're achieving with when the calves suckle colostrum. We want to improve their immunity so they can fight off diseases. So we have to be more specific, or we unfortunately need to be more specific with the vaccines. We have to pick the pathogens that we want to protect them from. Whereas with colostrum, it's sort of, it covers hopefully everything that they need. So vaccines are for prevention, other drugs such as antimicrobials, antibiotics, or to treat diseases. So we can use these vaccines in different ways. And there was a question just earlier about vaccinating pregnant cows, and we'll talk about this. So there's various ways we can strategically use these vaccines. So for one, of course, we want to protect the animal that receives the vaccine from getting a certain disease, or like black leg or pink eye. But then we also vaccinate the females either before the breeding season or during pregnancy with these vaccines that should prevent pregnancy loss. So some of these, especially some of these viruses, but also some bacteria that we vaccinate for, can cause abortions or can cause reproductive loss. And we want to use the vaccines to prevent that from happening. But then we can also strategically use vaccines to improve the colostrum quality, as Dr. Abdel Fattah has told us, especially the ones for scours, like rotavirus, coronavirus, or E. coli. These vaccines are typically given late in pregnancy so that the cows mount this immune response at a time right before they translocate their antibodies into the colostrum so that they're available to the calf. And it's not so critical for these viruses that we vaccinate multiple times during their lifetime anyways, and that they might be exposed to. But for an adult cow, she likely doesn't have rotavirus, coronavirus antibodies in her system anymore. So we need to give that boost. This is not something that you absolutely have to do. This is something that is recommended if you are experiencing scours in your calves. And the important thing is that you need to know what the pathogen is. So any one of those will not necessarily solve the problem unless it's actually directed towards the pathogen that is causing the scours in the calves. And yes, it's not always easy. Often when calves do have diarrhea, if you send in a sample for culture, you get a lot of, you can get up to 3 different pathogens. So it's a little bit tricky to come up with the best strategy, but this is something that you need to discuss with your veterinarian. So I want to talk a little bit about the different types of vaccines that we have. So we have modified lives, and as the name implies, they contain a live organism. So either a virus or bacteria. But as the name also implies, they've been modified. They have been altered in a way that they cannot cause the disease anymore. And they come with some advantages and disadvantages. So they usually lead to a better and longer-lived immune response than the killed vaccines. They may not require a second booster vaccination, so they have a longer immunity. And they may have a shorter withdrawal time, but they are also a little more finicky to deal with. So they need to be carefully stored and handled. Otherwise, they can become inactivated. So typically, those are the ones where you have 2 bottles and you have to mix them together. And you have to mix just enough that you use it all up. So you cannot store this after it's been mixed. It has to be used up usually within, hopefully within an hour. And then there is a word of caution for use of modified live vaccines in pregnant animals. So if the cow has not been vaccinated with the same type of vaccine, usually within a year, within the last 12 months, and you give this vaccine to her, she may abort. So I say this in my BQA trainings over and over, and I say it here again, whatever you give, you need to read the instructions. You need to read the label to make sure that you give these vaccines in the manner that they're intended to be used, or it can actually have adverse effects. And then killed vaccines, as the name implies the organism has been killed. So they're definitely dead. This is usually done with formalin or with heat treatment, but they also require something that's called an adjuvant, because the immune system doesn't readily recognize this as something to respond to. So we have to add something else to it. So this is the adjuvant, but it all comes mixed in a bottle, so you don't have to do anything. This is an example, and this is by no means an endorsement of this particular vaccine. This is just an example. What I want to point out, though, is that vaccines have a name, and they usually have some numbers or letters afterwards. And all those numbers and letters are important because they tell you what's in it or something specific about this particular vaccine. And this becomes important. So Dr. McNabb, who will talk next week about artificial insemination, he has a story from a herd that he visited where they had a problem with early embryonic death. And it turned out that they thought they were vaccinating for Vibrio, and they didn't, because the vaccine bottle that doesn't have the Vibrio in it, it looks essentially identical to the one with it, except for a couple of letters. So it's just to point out, it's just a word of caution that all those letters are important. So the advantages of using a killed vaccine is that you don't have to mix anything. It's safe in pregnant animals. You're not going to run the risk of abortion. You can reuse a partially used vaccine vial, but you need to be clean, and we'll talk about that in a little bit more. And no risk of the vaccine organism spreading between animals. So that usually means there are some reports where calves are vaccinated with a modified live vaccine, then they suckle on the dam. And if the cows have not been vaccinated at all, so neither with a modified live nor killed in some time or ever, then that can cause a problem. Then that can actually lead to abortion. So that has been documented, that has happened, but it really only happens if those cows have never been vaccinated, or it's been a really long time. Other than that, it really should not be an issue. So the disadvantages is that the immunity is not as strong, and this is because the killing process alters that pathogen a little bit where the immune system is not responding in the same way, or it's having difficulty recognizing it as the same thing as the real pathogen. So that's why it's not as strong of an immunity. And then you usually have to give the 2 doses to get a booster, to get a second response to it. And they're also more expensive than modified live vaccines. So as mentioned before, you need to make sure you handle them correctly, whether they are modified live or killed. So the right dose, the right way of administering them. They have usually come with a withdrawal time that you have to observe before the animal can be slaughtered. Make sure you look at the expiration date, no mixing of anything pretty much that you give to cattle in the same syringe. You want to keep needles and syringes clean. So when you so ideally we want you to use a new needle for every animal, but we also know that that's not always possible. But as I mentioned before, when you first start using a bottle of vaccine, put a fresh needle in and then leave that needle in until you are done vaccinating. And that way you can make sure that you're not contaminating your vaccine inadvertently, in the heat of the moment. Things have to go fast. You don't want to put a needle that was already in an animal or in 10 animals and then put that into your vaccine bottle, because it really will contaminate the vaccine. It's also important not to use any disinfectants to clean needles, because especially with modified live vaccines, that will inactivate them. And then when you're done, when you clean up, and you have those multi-dose syringes, it's best to just use hot water to clean them. Definitely don't use anything on the inside of the barrel other than hot water, because anything, soaps, etc., disinfectants, they can leave a residue, and the next time you use it, it can inactivate those vaccines. Yes, and again, they should be used up in a timely manner, 30 to 45 minutes. So we want to give all injections in the neck area according to BQA guidelines. And most vaccines are given subcutaneously. Some are labeled that you can also give them IM, intramuscularly, but if you have the choice, we recommend that you give them sub-Q, under the skin, for beef quality assurance purposes. And then the intranasal vaccines are usually given to calves. That's a picture of how they're used. And they elicit an immune response only in the nasal area and the throat area. So this is for respiratory disease. And the advantage of using those is that because they're acting locally, you don't have to worry so much about the maternal antibodies. So we usually don't vaccinate very young calves because they have all those antibodies from the colostrum within their system. And so when we give a vaccine when they're very young, their antibodies will actually eliminate or attack the vaccine pathogen and render it, pretty much useless. So this was the advantage of the intranasal vaccine, is that is not going to happen because it is a local immune response. And here is just some examples of a couple of those intranasal vaccines. So vaccination protocols, and there was a question about, what kind of protocols they should use. It's really not possible to come up with a cookie cutter protocol. I will mention some core vaccines, but it depends on what is possible for you, where you are, your risk factors, etc., etc. However, these are the basic vaccines that all calves should get at some point. So we have the respiratory viruses, so IBR, BRSV, BVD, and it seems like the vast majority of you do give those. And then a vaccine for clostridial diseases. And that is a killed vaccine, and that needs to be given twice. So that is the basic minimum, I think, that should be given. All right. So in conclusion, we know that vaccines are important. They're a vital component of our biosecurity program. So that means we're keeping pathogens out of the herd. If, vaccine, you have to look at vaccines are kind of like an insurance. We're hoping that we never need it, but we do have them, and we have to pay for them. And yes, it's kind of it's kind of a pain to do that, but in the end, we don't want to. It will help us sleep better. So work with your veterinarian or an extension advisor in trying to customize a vaccination program in your herd. Making sure that you're storing and administering according to label. So, have a look at the label before you go out and vaccinate, and then follow BQA guidelines. There's also in the BQA manual, there's a lot more about vaccines, and I encourage you to look at that. It's under bqa.org. There's a ton of references and materials.
Dr.
Right.
Maier, one question before you move on
Yeah.
that was asked. It says, for cows that have not been vaccinated for a long time or their vaccination status is unknown, would you suggest starting with a killed vaccine first, then later a modified live vaccine?
So the killed vaccines, yes. For you cannot do any harm with the killed vaccine. It always depends. Well, so if this is for the adults, and they are on a breeding schedule, if you want to use a modified live vaccine, you need to get that in. The timing becomes difficult when you start an adult herd and you want to switch them to a modified live vaccine, because you need to give that at least 30 days before the breeding season starts. 60 days is probably better because it can actually interfere with fertility in the beginning. The other thing is, yes, if they are pregnant, then definitely you don't want to give that modified live vaccine if they haven't been vaccinated in a long time. So that's something, if you do want to make that switch, you really need to probably start with your heifers, your first, your replacement heifers. If you start with them on a modified live schedule, then you can revaccinate them yearly with a modified live, and it shouldn't be an issue. With the adult herd, that's a little bit harder to transition, and you really need to work closely with a vet if that's what you want to do. All right, I think we're going to continue with castration.
Yes.
Excellent. Great. All right. So next topic, we're going to talk about castration of beef calves. So first, why we castrate beef calves? First, for decreasing aggression between calves, by removing testicle, the main source of testosterone hormone. Steers seems to be less aggressive than intact male. So as you see in two pictures here, also it's showing that when you remove the two testicles, and this is beef meant to be for meat production, and consumer looking for marbling appearance, like you see when you get a beef or a steak, you have the muscle fiber in between, you have a fat. So to get this marbling appearance through castration, So you decrease the number of animals with high muscle pH and improve the overall quality of the meat. And again, if you have any aggression, that's gonna lead to bruise on the meat and gonna decrease the quality and the price of the meat at the slaughter facilities. Okay, the two pictures here showing you Angus, black Angus male with intact testicle, and look at this one here. This is more muscular, seems like he's doing workout, and this one here like castrated. So we expecting gonna see a fat in between muscle fiber. How to castrate? There are two main classification for castration. There is bloodless and bloody castration, what we call surgical castration. And this have to be done with trained person, most likely done by veterinarian. So surgical castration is seen in the series here in figures. Start with in the left side here. We start by one and opening the scrotum by type of knife, special type of knife. And then we grab the two testicle out. And then because this two testicle connected, but what's called spermatic cord that carry blood vessel, nerve, and lymph, we do severing first the spermatic cord in order to prevent bleeding. So there is a special instrument, as you've seen here in the right. This is called emasculator. This machine, like a cleaver, it's by you doing severing the spermatic cord before cutting to prevent bleeding. As this method, it's need to be trained to do it. There is high risk of bleeding and blood loss, high risk of infection, but if it's done right with trained person, will be okay. The second type of castration is what we call bloodless castration, because there is no surgical procedure and there is no opening here. The first type is called banding, and the name came from using band. So in this way, we just place a heavy elastic band around the neck of the scrotum using a special instrument called illustrator. So you see here in the left side, this is a machine illustrator loaded with this elastic band or rubber band. And what we do, we load the ring and we open the illustrator, and then we pass the two testicle in between, and we leave the band over the spermatic cord in this area here. So here, when you have two intact testicle, you apply the castration band, and the theory behind it that the castration band can stop the blood supply and nerve supply to two testicle. And as you know, any organ without any blood supply will actually die and slough off. So usually this process takes 3 to 6 weeks until we see sloughing of the two testicle. Main thing to consider with this method, you need to do it as early as you can. So when calf as young, and you have a small size of two testicles, so you can pass it through the band. And because it stay too long time, like up to 3-6 weeks, it's a kind of causing chronic pain, and I'm gonna talk about that. But we've seen many people using the banding and with doing that within the first week of life. So as a problem with banding, as I mentioned, it's causing chronic pain, stay for 3 to 6 weeks. There is a company, Canadian company, came with this new type of band, and it's a unique idea that they load the lidocaine. As you know, the lidocaine is local anesthetic to numbness the area and stop feeling pain of the animal, stop feeling pain in this area. So they came with new version of band is loaded with lidocaine. So they infused lidocaine to the band, which it's gonna be win-win. It's doing dual purpose. So it's gonna prevent blood supply to the area, but in the same time provide a kind of local anesthesia by applying this. And company claim that that's gonna reduce pain for up to 40 days. Up to our knowledge, there is no any scientific study done on this use of this band. We don't know if it's gonna last for 40 days or no, And this might something we're interested in future. Another bloodless castration method is using Berdizo. This instrument you see here at the right side is like a clipper. It's a special instrument, and this is you expand the two testicles away from the body, and at the area of the spermatic cord, you crush the spermatic cord while the skin is intact. So there is no need to do incision or opening. It's from outside, you crushing the spermatic cord, okay? And by crushing spermatic cord, again, you preventing blood supply and nerve supply to the two testicles, which are gonna fall down after several weeks. This method, because it's very painful, becoming less common in cattle industry. And also the problem or a disadvantage of this method, it have a higher failure rate. We've seen research found it's up to 35%. Like you do crushing, and after time you found that the animal is still intact and showing the sexual behavior. Okay. And as I mentioned, it's very painful to the animal. So what is the question here? When is this is one of the questions we received. When to castrate? What's the best time to castrate? Some producer prefer to wait and castrate calves in groups. And we understand that because of time and it takes time commitment. Okay. And there is a wrong belief that the more you wait, it's better for animal and better for gross performance. But in fact, the research found different result. As you see here in this chart on the right side showing you the age of the animal from 0 up to 12 weeks. And here in y-axis that showing the average daily gain, pound per day. The research found the more you wait and castrate the calf later, there is significant decrease in the average daily gain. Okay, so the best way is when you do early is better for performance and better for pain for the animal welfare. So castration before 3 months, it seemed to be less painful and less discomfort for animal. And even still, the animal is still young, so it's gonna be easy to handle and restrain the animal for castration. It's gonna be low risk of bleeding because the vein is still small in size, okay? So the bleeding is less, and infection and less loss of body weight, okay? So the timing is very important because the timing gonna affect on morbidity and mortality. This research done found that a calf castrated open arrival had 17 to 58% higher risk of disease compared to the calf just castrated after birth. So waiting until calf reach 2, 3, or 6 months is not recommended. So earlier castration is better, okay? Because banding is painful and cause chronic pain, and also to consider the size of 2 testicles. So when you do banding, which is a way by applying the band, it's better to do it within the first 1 week of life of the animal. Other method, if you use any other method, surgical or other method, it's better to do less than 3 months. Cool. So how to restrain the animal or beef operation? You can restrain animal if they're still young by restraining from the tail, twisting tail back. That's a kind of restrain the animal by doing a pressure on the nerve in this area. Gonna restrain. Some people castrate while animal is standing. Or we can castrate by using hydraulic squeezing chute here, as you see in the picture, okay? And most of the beef operation have this type of restraint machine. I want to mention that all methods of castration result in pain. We recommend that to start to use pain management because all of methods by research showing that castration is resulting in pain. And also as for public concern, we've seen that the public concern are increasing, as a consumer concern are increasing regarding not using pain control. So if you can use whatever best for you, whatever work best for you, we understand the time limitations, the cost, but it's something you can consider in future, okay? Because especially like surgical castration inflict research shown that inflict a higher level of pain that might be last for a few days, okay, or maybe months, okay? Research found that castration by banding induce a mild but chronic pain that can last over months. So here is a challenge: how I can use pain control in beef operation. It's not dairy, it's not like confined in free stalls. So how can you use that? So actually, if you're doing surgical, you can do local anesthesia by infiltrating the skin or the area here where you're gonna do incision by lidocaine. And also you can inject any type of anti-inflammatory like Benamine or fluniximab. And is that something easy to get trained on? Or recently, we've seen that we have a Benamine transdermal. You don't need to do any injection, just pouring at the dorsal line as you see here. This Benamine, this company came, and it's associated with like less response for pain and inflammation that might last for 8 hours. So that's something like maybe you think about to use this transdermal Benamine and just applying over the skin, okay? But it still required prescription for veterinarian. So we might need a prescription, work with the local veterinarian to get transdermal Benamine. Regarding the question here for use of tetanus shot, so there's a precaution when you do castration. First, the castration comes with the risk of tetanus infection. Tetanus is a bacterial infection caused bacterium is a bacteria from Clostridium. Clostridium tetani found everywhere in the dust on the ground. Okay, so it's a local inhabitant. So there is a high risk coming with tetanus, especially if you are using unclean instrument that you're using, you're not cleaned, that's gonna have a high risk of tetanus. And we've seen that especially with banding. So it's very important to use, and highly recommended to use, there is 2 options for using to do prevention of tetanus. Either to use tetanus vaccination, which is gonna last for a long time and give protection for a long time. So some veterinarian can give tetanus vaccine and is he giving just before castration. And some people using what's called tetanus toxoid, okay? And this, when you use tetanus toxoid, you have to give 2 doses, okay, required, with the second ideally giving 2 weeks prior castration. So 2 weeks prior castration, gonna give 1, and the second one at the day of castration. The problem is antitoxin is last for short time, but vaccine lasts for a long time. So you have 2 options, either to use vaccine or use tetanus antitoxin. It's a type of antibody you inject it and give protection, but it lasts for a short time. How to minimize the risk of infection? Usually use a sterile, clean, disinfected instrument. Okay, seen people bring bucket with them and put this instrument in type of disinfectant. Sanitize instrument if you can between animals if you can. Sometimes the time limit, but this is, we're telling you the ideal, but you can see what better work with you. Thoroughly clean the surgical tools, clean it and keep it dry for next time, and store it in dry, clean area. Try avoid castration in a very hot weather, okay, and use clean instrument. So that was a brief introduction about castration.
So yeah, so we're going to switch gear and talk about naval care. So this is a diagram of the anatomy, and so this is the anatomy of the inside of the calf, because we see the umbilicus, but you know, it's this little lump that's hanging there after birth. And I just wanted to show you what happens, you know, behind the scenes. So I'm sure, as you're all aware, the umbilicus is what connects the fetus to the placenta in utero. So that's where the nutrient exchange takes place. So the blood comes in and it goes through this umbilical vein directly to the liver, because we don't have, the calf's not eating, so the blood, it gets blood flow into the liver to deliver nutrients right there. So this is a really important organ. And then the way the blood leaves is through what we call the umbilical arteries, and it goes out, and then it's a circuit essentially. It goes to the placenta, it takes up more nutrients, it goes back to the liver. And then there's also this little piece called the urachus, and that is connected to the bladder here, and so that is how the fetus eliminates waste products. So that also leaves through the umbilicus. And so I just wanted to show you this, to show you that, you know, when the calf is born, these structures will all stop being necessary, but they still, for a little while, are there and connected to these important structures, and as such are a gateway for bacteria to enter the body. So this is how normal healing looks like. So in the beginning, there's sort of this lump that's kind of flexible, but then after a few days, it starts drying up and it will become really hard and then shrivel up even more. And then eventually it will be a scab. And finally, you can hardly tell that there was anything there. So this is another view. This is what it looks like very early on day 1. And then this is just 7 days later in this instance, and it is all dried up. So this is all normal, but this is what it can look like when things go awry. So there will be swelling, redness, and in this case, we have pus that is exiting from the umbilicus. So these calves, what you want to look for is a calf that kind of looks like this. So they're obviously not feeling well. They can be hunched up, maybe short-strided because walking hurts. They're listless, no appetite, and there's not really that much that can cause this in the first 2 weeks of life. The other thing that can happen is a diarrhea, but you would see a soiled back end. So if you don't see any signs of diarrhea, but you see a calf that's obviously not feeling well, you may want to think about an umbilical infection. And then a sequela, so it's something that can happen down the road from this, is that once these bacteria enter the body, they can circulate within the bloodstream, and then they can set up shop in the joints and then lead to what we call septic arthritis. So these are swollen joints, enlarged like this, where if you opened this up, you would probably get some pus out of it. And those can be really hard to treat because it's so difficult for antibiotics to reach their place. You know, you can try and flush them, etc., but it's sometimes unrewarding to treat them. So this, on the other hand, so this is looks like a little bit older calf. So what this is a hernia, an umbilical hernia, and that is a defect in the body wall where the umbilicus came out. So that means that there could be intestinal loops or other content from the body in this sac. And so sometimes this goes away on its own, but most of the time it needs a little surgery. So don't get confused. Well, this is also a problem, but it's a different problem. However, an umbilical infection can set them up for this. It can weaken the body wall and lead to a hernia. So what are some risk factors for this umbilical infection? So again, we come back to our colostrum. So good colostrum shields them from getting these infections. Because if they have a lot of immunity, if they have a lot of antibodies, then those antibodies can attack any bacteria that find entry into the body. And also hygiene is important. So if calves are born in unsanitary conditions, or if they're born inside a barn, or when the stocking density is really high, if it's muddy, that can also be a predisposing factor, of course. I mentioned here the sandhill calving systems. I just want to mention real quick what that is. It was developed mostly for prevention of diarrhea in young calves, but it could also help to prevent these umbilical infections. So the way it works is you start with everybody in one group when they're calving during the calving season, and then depending on how many cows you have, a couple of weeks later, you move all the ones that have not calved yet out to a different pasture, to a different paddock, separated from the ones that have already calved. And then 2 weeks later, you do it again. And the idea is that you have different cohorts of calves that are all about the same age. And that means that they don't share their pathogens, or the ones that are born latest are not exposed to all the pathogens that have already been shed by the older ones. So what is it about dipping? So is it necessary? Well, so I can't tell you, because all the studies are disagreeing with each other. So some think that it has benefits, and others say that it doesn't make a difference. So I can't really tell you whether it's something you need to do or not. I would say that if you do not dip, and it seems like that's the majority, and you don't have an issue with these naval infections, I don't think you need to start, since the research is not clear anyways. If you do dip, I recommend to use disposable cups like Dixie cups, just because if you use the same cup and you go from calf to calf, and things can get hectic during the calving season, you may actually be doing more harm than good. So we already know these are the products that are available. So at some point, this tincture of iodine was restricted because it was an ingredient also in meth labs, but it seems like it's not an issue anymore. So these two are good products. There are other products, commercial products, and I just want to mention that even though they sound like they're 7% iodine, they are not. So Super 7, there's something called Super 7 and something called Triodine 7. So I'm not entirely sure what's in them, but it's not tincture of iodine. So tincture of iodine has alcohol, that's a drying agent, and that speeds up that drying process that we want to achieve, so that that umbilicus shrivels up quickly. So what do you need to do when you suspect an umbilical infection? So you need to have an established protocol from your vet. And these calves do need antibiotics. So it's a bacterial infection, so it should be something broad spectrum. Pain control would also be good, because as mentioned, this is painful. They can be sometimes a little bit tricky to treat. So if this does not seem to do the trick, if this does not lead to resolution, it may require some more invasive procedures, so flushing or surgical removal of tissues, where you need to get your vet and have a look at it. So dummy calves are those calves that, as the name implies, they don't seem to know what to do when they're born, and they have trouble fine nursing. They just seem to be a little bit out of it, and they could be hypoxic, so they could have suffered from low oxygen during birth. But another theory is that especially, I don't know, sometimes calves that are born through C-section, they didn't go through the birth canal. Somehow going through the birth canal and being squeezed seems to trigger something in their brains. And for whatever reason, if they don't have the right experience doing that, we have some research that was actually done here at Davis by Dr. Madigan, that if you if you simulate that squeezing after these calves are born, and actually he developed it in foals, so for foals it works too, they can sort of snap out of it. And so, if you think you have a dummy calf, this isn't something easy to try. There's actually, if you Google it, there is a pretty good YouTube video available on this topic where somebody shows how to do this. So I don't have anything, right off the bat here, but it's easy, and we can put that in the resources that we distribute. So you need a long rope. You attach it around the calf, between the calf's forelegs, and you make a half hitch a couple times, and then you apply some pressure. Obviously you still want to have the calf be able to breathe, but they will go into a kind of like a trance, and you need to keep that for 10-15 minutes and then let them go. And sometimes, it doesn't always work, but sometimes they, as I said, they sort of snap out of it and they sort of wake up and become more active. So that's the Madigan squeeze. We also have more questions that were pre-submitted. So there were a couple questions about when to dehorn. And so it's kind of like castration. The earlier, the better. What I personally like best is the disbudding when the horn has not fused yet with the skull. So that happens around 8 weeks. And you can use either a Barnes dehorner, like shown in this picture, or a hot iron dehorner. If you use that, you need to clip the hair around the horn bud. But don't use any alcohol for disinfection, because of course that could set them on fire, which we don't want to do. There's also the this budding paste, which personally I have actually no experience with. I've never used it, and to be honest, I don't really like it. From what I hear, it can wash off, it can rub off on on another body part or on another calf. So I would rather you not use it. Whatever you use, it is very good practice to use a lidocaine block. And there is another YouTube video that we're going to share that shows how somebody gives a block and then uses a thermal disbutter or hot iron dehorner, and the calf does not flinch. And it's just one person holding the calf and dehorning it at the same time. And it just shows that giving these lidocaine blocks is really makes it a lot easier on the calf. So for lidocaine, you need a prescription, and you need your vet or somebody to show you how to give that block so you do it correctly. But it is definitely a good practice. Okay, another question was, once a calf is born, what are signs of trouble and how to manage? So I think we talked a lot about making sure that they can suckle, that they have a good suckle reflex. And then if they don't, that then they might need help with colostrum eating. So that, you can try a bottle. If they don't drink the bottle, you need to give them the colostrum through the esophageal feeder. But before that, I guess something more immediate is that the calf needs to breathe, right? And so this is especially important when you pull a calf, and it may have already, it's been a while in there. It was a long birth. It may be hypoxic. So making the calf, encouraging the calf to breathe is really important in those instances. So first you want to, get all the fetal membranes out of its face and its mouth. You maybe use some suction with a turkey baster, and then putting them in what we call sternal recumbency. So not on their side, but sort of in the middle on their breastbone, and then have the hind legs stretched out so that they don't flop. They can't flop to the side. That helps them breathe. And if they still don't breathe, you can splash a little water on their head or maybe in their ear. Sometimes that sort of, makes them take a gasp. What you don't want to do is hang the calves by their back legs. That used to be something that was done because they will lose some fluid through their mouth, and it was thought that comes from the lungs. Well, it actually doesn't come from the lungs, it comes from their stomach. And it also makes it so that they cannot breathe as well because all the intestines are now pushing against the diaphragm. So don't do that. There are some other things if there is a lack of bonding between the mother and the calf. So often that it happens more with heifers because they don't really understand what's happening. So if, there is a product called Therapies, it's usually used for weaning calves, but it can also be used for the heifer, that heifer that has just given birth. It just calms them, and bonding with the calf, it's all about smells and hormones. And so this is something that you can try out. Another trick is that if the cow is not licking the calf, that is also important to kind of stimulate the calf. You can pour something that tastes good like cornmeal on the calf's back. It will kind of stick to it because they're all wet. And so, the dam will then start licking because, they want to get to the treat, but it has the good effect that it will also encourage that bonding. How can I decide if a newborn is in need of intravenous support? Typically, IV fluids, we need them mostly for scouring calves. That's because they lose a lot of fluid, and they also can have a lot of electrolyte abnormalities because of the diarrhea. So they can become very acidotic. So that means their pH, their blood pH is too acidic, essentially. And so when you see a calf that's scouring, if it's listless, if it has no suckle reflex, and it just looks like it's dehydrated with sunken eyes, those are calves that are good candidates for IV fluids. Also, if they're severely sick from other diseases, so anytime they're losing their appetite, from a pneumonia, for example, or from something else, from a septicemia, they may be good candidates for IV fluids. There was a question about steps to solve low birth rates or fertility issues or causes of abortion. So that's a big topic. That could fill an entire evening, I think. But I try to summarize it in a few things. So first step is to determine whether it is really a problem. And so that means that you need to compare data from year to year. So that will show you, that means that you need to have that data. So you need to keep records on who gives birth and who doesn't. So that will show you whether you have a trend. Is it just a trend that is, it's slowly declining, or was there a real difference from one year to the next? And then what exactly is the problem? Is it the cows that are not getting pregnant, the heifers, the first calf heifer, so basically the second pregnancy? Is it that? What is the pregnancy distribution over that breeding season? So do we have everybody, do we have most cows get pregnant in the beginning, as we want to see? Or is it sort of are they all getting pregnant towards the end? And that could mean, well, they eventually got pregnant, but they just ran out of breeding season, so to speak. And so that could be an indicator that they weren't ready. So that's most likely the case when there is an issue with body condition score, with nutrition. Were there abortions? So when did they occur during pregnancy? So for abortions, it's really the best if you can involve the diagnostic lab. It's really difficult to pinpoint what it is otherwise. And then some common reasons for fertility issues, as I mentioned before, low body condition score is the number one reason for fertility issues. There could be nutritional deficiencies. Vitamin A, copper, or selenium are the most important ones. And you could do some blood testing. For vitamin A, it's a little bit more tricky, but if vitamin A is something that's in that is in fresh feed, and if there's been a drought, that can become an issue. Have the bulls been semen and trick tested? So maybe it's not the cows, maybe it's the bull. Are the lameness issues with the bulls? Are they vaccinated for Vibrio, as my story from before? Or did you just believe that you vaccinated them for Vibrio? So those are, in a nutshell, things that you should think about when you want to think about abortions or fertility. How to tell when calving is imminent and when to intervene in the calving process. So we do have a whole talk on it was called Time to Help During Calving, and that was last year. So I believe we have that recording still on the webpage. But I pulled up a couple slides from that. And so some signs of impending calving are, well, the udder enlarges, the vulva becomes swollen, there is maybe some discharge from the vulva. The peripelvic ligaments relax, so you can see the raised tail head, and then behavior changes. So cows that are about to calve, they usually become restless, but they also separate from the rest of the herd. And then when to intervene. So we have 3 stages of labor. The first one is the one where you don't really see that much, but you probably see, well, you see those signs like the udder enlargement. Well, that happens over a few days, but you don't really see you don't see the calf or the water bag yet. Then we have the stage 2, the calf delivery. So you'll have the water bag, you see the calf gets expulsed. And the stage 3 is the expulsion of the fetal membrane, so the placenta. So when to intervene? So once you see a water bag or you see the feet sticking out, you want to check back every 15, 20, 30 minutes. If you don't see progress, if you come back, you see the 2 feet sticking out, you come back half an hour later and nothing has changed, you still see the 2 feet sticking out, yes, then it's time to do something. It's also a little bit, heifer, if it's the first birth, they need a little bit longer. A cow that has given birth to, it's her 8th or 10th calf, that should go a little bit quicker. So it is a little bit of a judgment call, but sort of a big rule of thumb, a rough rule of thumb is if there's no change within half an hour, you need to check. Somebody said, if calves are getting sick just prior to and after branding, the first vaccines, should the branding be moved up? Well, so I think the bigger question is, so why are these calves getting sick? Is it stress? So typically, and I suppose that what they mean by getting sick is respiratory disease. And that often has to do with being exposed to some sort of stress. So is it the weather that maybe just not very amenable at this time of year? Is the handling stressful? Are cattle maybe handled a lot? So we know that herds that use AI that give, that have to give a couple shots or a few shots, they're usually struggling with more respiratory disease than herds that don't do that. And that's just because you commingle them, and then also maybe the added stress can lead to more respiratory disease. And then of course you also have to ask yourself, how about the colostrum? Do they get good colostrum, or maybe they have some deficiencies? What about selenium in these calves? Do they have access to selenium, or maybe if they don't? So calves also will consume minerals, but if they don't have access to these minerals, maybe they need a dose of selenium through an injectable. And then the best calf vaccination protocol for my region. So, again, I don't want to really want to give a cookie cutter recipe, but we also had a webinar on whole herd health plans a couple years ago, and it should also be available still. So again, I just wanted to point out again that the core vaccine, so 4-way respiratory viruses, could do it intranasal as young as at birth, and clostridial 7 or 8-way. So when they're really young, under 3 weeks, they will probably only respond to the C and D portion in that vaccine. But if you give it, at branding and at weaning, that's great. And yes, there was a comment before about the vaccinations, and yes, they should get 2 doses of both of these, just to clarify.
Thanks, Gabby. We got one more question related to the question about moving up the time of branding. So if folks are branding at an age when the maternal antibodies are already declining, would it be valuable to brand earlier when the passive immunity would be stronger?
So yeah, well, that's a good question. So the thing about declining maternal antibodies is that they don't all decline at the same time. So we don't really, they're not all on the same trajectory. So it's always sort of a give and take, or there is no ideal time, basically. I mean, if there was an ideal time, we would tell everybody, this is exactly when you should give, your first vaccine, because we know maternal antibodies are gone. There's also individual differences. So depending on how much colostrum each calf consumed, they, have either longer immunity or shorter. Or, it also depends on the quality of that cow. If it's a heifer, they may not have as good quality as the cow that's been around for many, many years. So it's not that easy to answer. There's not, as I said, there's not like one time point that's ideal. In general, depending on when they brand, how old the calves are, if they feel like, yes, we are already too long out, again, I would say, discuss it with your vet. It's hard to make these judgment calls because I don't know the operation, I don't know the area, I don't know what else is going on. It's definitely something to ponder.
Thank you to Dr. Maier and Dr. Essam for sharing with us details on neonatal beef calf health. During the video, there were references to resources and other webinars. You can find those at ucanr.edu/beef www.vet.gov/sites/rangelands/cattle health. Thank you for watching this webinar recording that was brought to you by University of California Cooperative Extension and University of California Davis Veterinary Medicine, and was co-hosted by University of California Cooperative Extension advisors Tracy Schohr, Grace Woodmansee, Rebecca Ozeran, and specialist Dr. Gaby Maier.